Okay, let's go ahead and get started. Good morning, good afternoon. My name is Carrie Mackey. I serve as Associate Director with the Center's Rule of Law program. Thank you for joining the speaker series today on law enforcement accountability in the Carter Center. And also many thanks to our colleagues in the Center's development and education departments, including Anne, Alden, Lauren, Bronwyn, and others for all of their support, Briani and others for all of their support in organizing today's event. And thank you to Jason for serving as our webinar host today. We are very pleased to have speakers joining from 3 different continents, including current and former Carter Center colleagues. So fingers crossed, technology will be on our side today. As noted on the flyer that went out, corruption, excessive force, profiling, deliberate evidence tampering, and discrimination can all erode public trust in law enforcement, and by extension, peace and security. Since 2017, the center has been supporting national police forces in Liberia and more recently Costa Rica to better reflect and serve their constituencies through improved transparency, accountability, gender equality, and we are looking to expand this work both internationally and domestically. So by the end of today's discussion, we hope that you will have a better understanding of why law enforcement accountability work is important, what the Carter Center is doing in this area, and some of the opportunities for expansion of this work. Today, you will hear from the following panelists. And as I give your introduction, please just wave your hand, although everybody's names are there too. We'll hear from Lami Kapargoy. Lami is a lawyer who currently serves as a senior program officer in the Center's Rule of Law program in Liberia, where he works with security agencies to help foster greater transparency in their interaction with the public. Lami is a Chevening Scholar, a Reagan Fassel Democracy Fellow, and a U.S. State Department Community Solutions Fellow. He holds an LLM in labor law and corporate governance from the University of Bristol in the United Kingdom. Sarah Castrillo is originally from Costa Rica. She holds a master's degree in project management as specialization in contemporary migration. She also has 10 years of experience in implementing international cooperation projects, especially in the areas of security, crime, and violence prevention. She has used her professional background to advance gender equality, including supporting the first and unique Academy government collaboration for the study of gender violence within the Costa Rican police forces. Currently, Sarah works as the center's project lead for law enforcement accountability work in Costa Rica. She also is the program coordinator of the Foundation for Peace and Democracy and is a member of the board of directors for the Latin American Network for Democracy. Benedict Dawson. Ben is a key member of the center's global behavioral health team and a county program lead for the center's mental health program in Liberia. He leads the center's efforts in mental health workforce development, policy support, advocacy, and stigma reduction, and is actively involved in speaking sessions and stakeholder engagements in local and global levels. He works closely with government ministries, international organizations, civil society organizations, and training institutions to strengthen and sustain Liberia's public mental health system. And as a representative of the Carter Center on the Technical Coordinating Committee on Mental Health for the Liberian Ministry of Health, he helped develop the first and second mental health policies and strategic plans, and is currently involved with the development of a third policy and plan. He previously served as Director of Gender and Social Inclusion with the Millennium Challenge Account Liberia, a counterpart to the U.S. Millennium Challenge Corporation, where he led development and implementation of gender integration and socially inclusive policies and plans for implementing entities. He is currently the president of the National Association of Social Workers of Liberia and also serves on 2 major ethics committees, the National Research Ethics Board and the Atlantic Center for Research Evaluation, IRB, in Liberia. Tom Updike is the founder of the Communities and Police Partnership, TCAP, out of a desire to enhance the relationship between communities and police in Metro Atlanta. Against the backdrop of the events of the summer of 2020, he saw a need for new approaches to improve how law enforcement and the public engage with one another and how community and problem-oriented policing concepts could address needs on both sides. Before TCAP, Tom worked for a European Union public safety reform project in Southeast Asia. He was part of a team of international experts that sought to transform a national law enforcement agency at all levels and instill a community and problem-oriented facing policing ethos among all officers. Prior, Tom was based in Atlanta and served as the government of Japan's political advisor for the U.S. Southeast. He also worked at the Carter Center, both in Atlanta and Sudan, on election observation projects. I have prepared questions for each panelist and reserved approximately 7 minutes for answers. And to ensure we stay on track, I will let you know when you have about 1 minute left. For those of you in the audience, thanks again for joining. Should you have questions at any time, please feel free to put them in the chat. We will turn to them following the initial panel discussion and hope to have approximately 15 minutes for Q&A. So let's turn to Lami. Lami, can you tell us about the value of law enforcement accountability mechanisms, what they are, especially focusing in on complaints and accommodations, and how they function and what the center has done to support these efforts in Liberia?
Okay, thank you, Carrie. I will firstly start with what the Carter Center has done, because I think I should end with how valuable these interventions have been. So starting back in 2017, we started working on a project called the Advancing Liberian Police Accountability and Citizens Trust Project, which we call OPAC. That project was supported by the U.S. State Department, specifically the Bureau of International Narcotics and Law Enforcement Affairs, INL. So under that program, we work with the Liberian National Police. And that program had actually just come about after the Police Act was reformed, and they had decided that they would include a new commendation system in there and elevate the Professional Standards Department that is responsible for public complaints to a department instead of it just being a section or a division of the police. So the Carter Center intervention basically firstly was to look at how to reform the law to create a proper legal environment to ensure that the complaints section of the Act is provided real legal framework or real legal framework, and then to also create accommodation systems and create a legal framework for accommodations, since the Act had decided to create that. So we work with the Liberian National Police, we work with various officers, especially at the senior and middle levels. We work with them, we crafted these legal frameworks, and they were issued, and it became the framework on which these two systems are being implemented. So as a part of that, we also we helped the LNP to create what we call the Fine Officer application. So if you went to the Liberian National Police website, there is a link there for a Fine Officer application. What this application basically does is that it provides the public an easy ability to identify police officers and to also file complaints against them, and also to commend them if they do good things. So that app was launched as a result of that project back, I think it was in 2018-19, the app was launched and it's been operational. So what happens is that if someone in the general public sees a police officer doing something wrong, or a police officer has done something wrong to that person doesn't have to necessarily walk to a police station in order to complain the police officer. If they have access to a smartphone or they have access to the internet, they can go online, use the police officer's unique 4-digit number, and they will be able to identify whether that officer firstly even is a real police officer, because there are people who go around impersonating that they are police officers. So they will be able to identify firstly whether that officer is a police officer, and then they will know, the app will tell them where the officer is assigned, what the officer's rank is, what the person's name is, and the person's telephone number. Not the person's telephone number, the person's photograph will also be in the app. So they can be able to see in real time whether the individual standing before them or the individual that they are interacting with is actually the person who they claim to be. So that's one of the real the importance, one of the real importance of this app, it provides the public the opportunity in real time to identify police officers, see the photographs, and actually see whether this person is impersonating, because anybody could need ID number and just supply it. So you won't go and complain the wrong person or commend the wrong person. So in the app, you can complain of an officer for the misconduct, for doing something wrong, or you can commend the officer for doing something good, because we help them to do both ways. It's not only an issue of always complaining people for doing bad things, it's also an issue of also providing them accommodation if they do right. That project ended 2000 last year. That project ended sometime 2020, yeah, sometime 2020, end of 2020, that project ended, and INL extended the program to include two other security agencies, the Liberia Drug Enforcement Agency and the Liberia Immigration Service. Along with the Liberia National Police, these are the three non-military security agencies that interact the most with the public in this country. So the same work we did with the Liberia National Police in helping them to develop the discipline and meritorious award system is the same work we're doing with the Immigration Service and the Drug Enforcement Agency, Liberia Drug Enforcement Agency. So as part of that work, we've worked with these two agencies. We've developed their policies on complaints and commendations. They are in the process now of issuing those policies. So the heads of those two institutions are in the process now of issuing those two policies. For the Liberia Immigration Service, 2 weeks ago, the Policy Management Board met and they approved all the different policy documents that we have helped them to develop over the past year. And hopefully next week or the week after, there will be a formal signing and issuance ceremony that will be done, hopefully for both these institutions, or at least for the Liberia Immigration Service. So the same application that we helped the Liberia National Police establish is in the process of being developed for the Liberia Drug Enforcement Agency and the Liberia Immigration Service. On the importance of these interventions, a week ago, I was one of two Carter Center staff that attended an anti-corruption workshop that was organized by the Swedish Embassy in Liberia. And there's always a huge degree of excitement when people get to know about these applications. So while we were talking about the different forms of corruption that happen, I told them about the fine officer application that is presently in use for the Liberia National Police, and there was a huge amount of excitement around the room. These are all anti-corruption people who work with these agencies, and most of them thought that that was a better tool to be using to hold police officers accountable than always walking into police stations and then having to walk into police stations to deal with those issues. Because as the law stands right now, you don't necessarily have to go to a police station to complain to a police officer. You can pretty much tell any police officer that is in reach, that person is under obligation to pass it on. But how useful that is an issue. So the app makes it a lot easier for people to look up police officers. And I do it all the time. Every time I encounter them, I try to look up to see whether the person is a genuine police officer or not. A few weeks ago, somebody was trying to get on a vehicle, and there was this police officer on the vehicle, and the person was a little bit afraid to get on the vehicle. So the guy said, "I'm a police officer." I said, "Really?" He said, "Yes." I said, "What's your ID number?" He called it, and I checked the app, and he was a police officer. So it made the other person kind of like confident to get in a vehicle because this guy was easily identifiable. So those are some of the reasons why making the police or security agencies really accessible to the public, especially around accountability, some of the reasons why they are very important. So for the other two agencies, we are in a process now of doing outreach. Firstly, we'll be starting an internal outreach to get the rank and file officers to get to know of these legal changes, these changes that have been brought about within the institutions. Because a lot of times, from my experience working with the different agencies, a lot of times, the officers themselves in these agencies do not like the discipline part of it. The professional standards department in the Liberia National Police is the least liked department, and it's understandable. People do not like to be chastised. It's the same thing in the Liberia Immigration Service. The head of the Liberia Immigration Service complains about the same thing. The officers here do not like me. It's understandable. I mean, if you're the person who will be investigating them internally and recommending that they get punished for doing something wrong, they're obviously not going to like you. And but it means that you're doing good work. If you're responsible for discipline.
You have about a minute left. Thanks.
Okay, so I will run up on that. These are the things we are doing. We're currently working with these other two agencies, and we're also working with the Liberian National Police at a reduced level to help to foster transparency in their ranks, and obviously to inspire public trust also in these organizations. Thank you.
Thank you very much, Lemi. Sarah, can you tell us a bit about the role that gender plays in law enforcement accountability and how the center has supported efforts in Costa Rica related to gender equality in the police forces? And then related at the end, curious your thoughts on how the center might expand law enforcement accountability work in Central America.
Okay, well, gender in policing is not only related to equality, actually. And accountability is not only about the quota of the parity of police women that we have in the police force. It actually is much more than that. It encompasses transparency in many other areas. For example, we talk about transparency and accountability when we look at the recruitment. Why? Because normally a ministry, at least here in Costa Rica or in Central America, they say, okay, we are complying with gender laws, national and international gender laws, because our quota of women is this amount. But it's not that. Why? For instance, when we look at recruitment, we have seen that there are so many barriers, like invisible barriers for women, that still within a ministry that has had so many sensitizations regarding gender, it's still invisible. Despite that, for instance, we can have 100 women applying for the police force. After the psychological test, only 7 women entered the police force. Are there any administrative filters that violate gender equality? What are those questions? How are we developing the questions? Are the questions by themselves filtering the quota of women that go inside the police force? Do they reach the questions? Do these violations reach the questions of a psychological test? This would clearly violate national and international laws, right? Why are there so few women with the rank of commissioner, which is the second highest rank on the police? We have 4 women from 70,000 police officers at one police force. How can this happen? If we have so many capable police women, how are they filtering the candidates to study for a promotion, right? For a scholarship. What kind of scholarship are we negotiating? So are those scholarships taking care of the different needs that a woman has, right? It's not the same needs that a man has. Why the percentage of women that can study abroad financed by the ministry is so low? I don't think it's because they don't want to learn, right? What is the administration measuring that women are not making it to positions as chiefs of or directors. Accountability must go beyond quotas and beyond parity. It must delve into the real problem and not the superficial problem. And this is exactly what the Carter Center is doing in Costa Rica. It is taking a promotion, retention, sexual harassment, and recruitment procedures and reviewing where the funnels for women are. It is making management uncomfortable in favor of responsible evidence-based accountability. And it's very unfortunate because policing is typically one of the areas where gender equality remains blurred. And why is this? It is because of the historical emergence of the military and the police force themselves. So, in Central America, it's very well known that sexism is very high. This situation will continue in the police forces, and there are even countries where the gap might be even wider than Costa Rica. This is why it is considered a golden opportunity for the Carter Center to apply these procedures in other latitudes as well, such as El Salvador, Guatemala. And I wouldn't recommend Nicaragua, but El Salvador, Honduras, and Guatemala would be a good target for the Carter Center. Thanks, Patty.
Thanks so much, Sarah. Ben, as our mental health expert on the panel, what importance does mental health considerations have in law enforcement accountability? And perhaps you can tell us about the value of crisis intervention training, what it entails, and what the center has done to advance such in Liberia.
Thank you very much, Carrie, and thanks to the previous two speakers. So overall, mental health is a human rights issue. So definitely it's important. You see, it plays an important role when it comes to law enforcement, that law enforcement officers are meant to protect the rights and welfare of persons with mental health issues. And this is for everybody, not just people who have severe condition. But it is important to understand the history of Liberia a little bit, because we went through a long period of civil war that was very much devastating. The loss of lives, I know, was as high as 250,000 according to estimates, and over 1 million people displaced. And after the war, a lot of attention, more attention was paid towards disarmament and less around mental health support, psychological support. And so we come from a place where people still need support, need healing. Then we were hit by Ebola, then COVID. So from the Carter Center standpoint, with all this poor history about war, trauma, and violence, up to 2009, Liberia had just one psychiatrist. So the Carter Center work in Liberia was to target three main areas. One, increase the number of the workforce, and also address law and policy and advocate around stigma reduction. So our work with the police falls in line with the advocacy and the stigma reduction component. The crisis intervention training we do is to empower police officers to be able to support persons with mental health problems who they come in contact with in the situation where they are executing their duty. Because mental health issues are highly stigmatized in Liberia, people still attribute the causes to witchcraft, possession by demons, and also that people did some bad things during the war. So this is the reason why they are paying for those things. And once you have a mental health problem, nobody wants to interact with you. And stigma is just like your thing, it's global, but persons with mental health problems, they suffer seriously. So they could be violated, they could be beaten, and other bad things could happen with zero consequences toward the perpetrators. And sometimes too, the police are perpetrators in this case because they use very excessive force when they deal with persons with mental health problems. They apprehend them seriously with handcuffs or other restraints tools, like tie them up. And this will go for a prolonged period, unnecessarily long, way longer than they would do persons who they think have no issues. And they also deny even delay access to legal counsel for persons with mental health problems. And persons with mental health problems will have other issues around inheritance issues. So if they, in terms of their rights being respected for what inheritance they are acquired, they are entitled to, they won't get it because they are quote unquote sick in the mind. And all of these things happen. So our program was meant to work with police officers to be able to work with persons with mental health issues and then provide them some support, help to restore their dignity, help that they will be able to de-escalate crisis situations. So if they interact with someone and they had a mental health crisis, the police have the skill set to be able to calm the situation down and work with the person professionally. They also can be able to provide some level of psychological support to persons with mental health problems. And then they can properly navigate both the legal system and the health system. Traditionally, what the police officers would do, no matter what situation they found the person in, they will grab you, apprehend you, and take you to jail. But in this case, with the crisis intervention police officers who's able to detect that this person has issues, they might be able to take this person to the health facility or the mental health facility to have treatment. And once the treatment is done, the person then can be introduced to the system to go through the justice system. So they do that. And so they refer them appropriately. So these are that we've been able to train over 100 police officers across the country. That's a very small amount because we're talking about a big country, but that's an important first step. And what we did is to develop a full-fledged curriculum for the crisis intervention. And this is not just being used by the police, but it's also a curriculum for corrections officers. It is meant to be used by immigration officers. And so we've trained a number of immigration officers as well as correction officers. Now, during COVID, it was important, it's interesting that the immigration approached us and said that they needed the officers who were serving at the borders to have the CIT skills, because they realized that due to COVID, as people went through the borders, they were stressed, anxious. So it was a lot difficult to work with them. And then they realized that the police officers who interacted, the immigration officers who work with those people, they were violent, they were less compassionate. So they thought that the CIT training would help these officers to interact better. So we trained over 35 immigration officers who were then spread across the borders. And we also trained some folks who work at the treatment units and the precautionary observation centers, because this is COVID time, heat of the situation where people didn't want to go in for treatment. They didn't want to go in to stay anytime outside their premises to be observed. So the CIT officers were best placed because they could interact with them with less force and help them to calm down and support the work of the mental health clinicians and the other crisis responders who were working in the facility. So this is how the program works. And by 2017, we established the Crisis Intervention Team Association of Liberia. So this includes the police, immigration, corrections, an organization of mental health service users. So who are persons with lived experience, and community members and mental health clinicians. So within this network, the police can easily relate with the service users in the organization when they have people who have issues. Because first of all, when people get treated, we don't want them to believe that's the end of it, because after treatment, especially for people who have severe issues, after treatment, there's reintegration and some back into the community. So the service user organization really plays an important role here. And when the police link them with this group, they are able to help people to get connected with their families again. And what we also see, which is another important reason why we think that the law enforcement and officers need the skills, is that when they take people to jail, there's no treatment there. And so if you talk to someone who already has a mental health problem and just lock him up, the only thing you are doing is exacerbating his condition. So, but with CIT officers, they understand. They even run a kind of structure where they would take people from the prison, take them to the health facilities, they get treated, and then take them back. So they've been doing all of this just to make sure that persons who have mental health problems can get the support they need while they are in prison or while they are in detention at the depot or other places where the police will interact with them. And so besides the curriculum that we develop, we have done the training of trainers, because we're at the point where we want the police to take on the CIT training, thinking beyond the Carter Center, supporting Liberia. We want this to stay. And so over 2 weeks ago, we're excited that the police, they have finally integrated the CIT curriculum into the national training curriculum. They are now training new officers in CIT. So as a new officer, as you come out of the training academy, you already have CIT skills to be able to do this. So, but we are looking more to see how we can support them in terms of really do more work to assess the impact of CIT. We've done a little bit of that. Some are qualitative with the police from the various depot and communities, and we've got real positive results. Like police, their image are sort of improved, especially depots where they have CIT officers, because locally here the police don't have the best picture. Yeah, so they're seriously disrespected in many ways. But some places, because of the use of force and how they interact with the community, people don't really see them as in good faith. But some with the depots where we have CIT officers, where we did qualitative assessment, talk with communities, talk with some of the officers, we got positive results. Some people saw the police in a new light, like the way they interact with them, and they thought that was a very good thing to do. So we are at the point now we are excited, really very excited that they can take on this program to integrate at a level. But the request that we are getting more now is to do more work with immigration and also include the DEA officers. We have now worked with DEA a lot. We just did the last training with immigration. A few DEA officers were included in that training, but predominantly they were all immigration officers. So yeah, and that's where we are, and I'm happy to take questions on this. Thank you.
Thank you so much, Ben, and congratulations for that important work. Let's focus on Metro Atlanta. The Carter Center has recently been charged over the past couple of years with turning an eye to potential work domestically. So Tom, TCAP is in our backyard right here in Atlanta. Can you tell us a bit about what TCAP is doing? That's the Communities and Policing Partnership in the area of law enforcement, and some of the ways in which the center might consider supporting this work.
Sure, and thank you. I think too, it's important to consider how law enforcement accountability in the US is just as crucial as the work that's going on in other countries, like we've heard in Costa Rica and Liberia, and we're experiencing a lot of the same issues, how you report complaints against police. For example, I would say Liberia is ahead of us in this. There are not many law enforcement agencies in the US that have an app that is as simple to identify the officers that someone's complaining about. And we have gender issues too with policing, from recruitment to advancement to how members of the public who identify as female are treated. And so these are issues that are very much happening in the US and not just in other places. One of the biggest issues in the US is that we are highly, highly decentralized. In Metro Atlanta alone, there are 111 different law enforcement agencies. That's your police departments, but it also includes your sheriffs, your marshals, your public university police, your public school police for K through 12. And each of those is governed by state laws for accountability, but have their own practices within that. So if you drive from Atlanta, where the Carter Center is, up to Rabun County in Georgia, you're gonna experience several different types of policing because there's slightly different training standards throughout. And so that then affects how the public then trusts police. One of the big things that TCAP learned in talking to communities is there is a sort of legal framework and legal window by which officers are trained to engage with the public and to respond to certain issues. So if there is an officer involved shooting, for example, there's a legal window in which the officer is told that he or she is able to draw their sidearm to shoot, and that could lead to a fatality. But then when we talk to the public, there's kind of what I've called the rational window, where a lot of times the public sees what would be rational in that same instance. And there's a really big barrier there. And so there's this big divide between what communities are looking for policing and what police are actually doing in policing. And that's kind of where TCAP comes in. Our whole goal is to enhance the relationship between communities and police in Metro Atlanta, and to try to bridge that gap and try to be a part of the conversation that's ongoing in the US right now. And a big part of what we're focusing on is what's called community and problem-oriented policing, or CPOP, because with policing, there are tons of acronyms, just like there are in the international development world. And CPOP's whole goal is to work in a way that brings community members and law enforcement professionals together to develop a shared set of priorities and build networks with each other, build trust with each other. And through those networks, you can better prevent and solve crime. And CPOP doesn't answer everything. There are, like Lemi was talking, there's important legal frameworks that need to be put in place in the US's case at the state level to ensure police accountability. But CPOP at least tries to address these things at a very community level. What's the scope that police can actually do? What is the work that they can achieve? And then what are things that community can be involved in? For example, when Ben's talking about having better response to mental health crises, it's the same in the US, where officers can only do so much. They're able to do a little bit more right now in Georgia because of a law that was just passed that then went into effect in July. But exactly as Ben said, jailing someone often exacerbates mental health issues and crises. And we're coming around more to that too. And so what Carter Center and TCAP and the Police Alternatives and Diversion Initiative, PAD, in Atlanta have been in talks to figure out how we could work together, is thinking about police accountability and the intersection of mental health, where PAD works a lot like the crisis responders that Ben was talking about, but they're not officers. They're trained professionals who deal with mental health crisis issues, that they can respond to something as opposed to an officer responding to something. And quick plug for PAD, if you're in Atlanta, 311, Monday to Friday, 7 a.m. to 7 p.m., PAD is available. The response time is about 17 minutes or so throughout the whole city. And PAD's work really involves trying to find ways to get people access to the services they need. So again, they're not just jailed. And where Carter Center and TCAP and PAD are all trying to work together is to try to find that way that we can help more people feel that there's more options than just policing. Police have a very particular role to play in the community, but police are actually very, very open to working with groups like PAD because it takes some of the pressure off of them. A lot of police officers I talk about how they just feel that they're tasked with dealing with every societal problem, and they would be very grateful for other people to come in and try to find different ways of dealing with these issues so that we can kind of solve them a little more holistically. Really, some of the big things that I want to charge to everyone here on the call in the US, particularly with police accountability and with just alternatives to policing, is to be informed about it. You know, being here right now is important, but also knowing the scope of what police can do, and then also what you can do in your community, what your community can be doing, what the services are that are available to people. That comes down to attending neighborhood meetings. That comes down to learning more about a group like PAD. That also comes down to actually just talking with police. We have a real resistance to that here in the US for lots of understandable reasons, but going to something like a Citizens Police Academy or doing ride-alongs really gives you kind of a good insight into policing, which then gives you the information to be able to speak up in an educated way about police reform here in the US. And beyond that, really trying to figure out what policing looks like in other countries. I think something like this is essential because we're hearing about it in Costa Rica, we're hearing about it in Liberia, but there are examples around the world of different ways to do policing that we could really learn from here in the US. So for example, the conflict resolution program that the Carter Center has brought in Dr. Gary Mason recently when they've been talking about policing work in the US, and he is a Northern Irish leader who has talked about the experience of policing in Northern Ireland. And they have a phenomenal example of how to work with communities better and the transition that the police went through there about 20 years ago of how you can engage better and sort of build those bridges and make it so that policing is something that serves communities as they want to be served, which is TCAP's whole goal and hopefully the future of what we can be doing with some work with the Carter Center.
Thank you, Tom. Greatly appreciated. And thank you all for your thoughtful responses. I'd like to add that the center currently is exploring expansion of law enforcement accountability work in Sierra Leone, as well as to other Central American countries. Sarah, you mentioned many, and I do have a follow-up question for you, and potentially South Asia. And in addition to Metro Atlanta, as Tom noted. Sarah, you had mentioned several countries that you would like to see Carter Center consider. Can you speak a little bit more about the suggestions and maybe why and which one you feel like we should hone in on?
Definitely, yes. I mentioned the Northern Triangle and excluded Nicaragua because of the stability. The government stability. And although El Salvador has right now Nayib Bukele, who is doing a very avant-garde political approach, it remains being very stable politically. This applies also for Guatemala and Honduras. But for Nicaragua, we know that we have Ortega there, and working in Nicaragua is very complex right now, especially working with government in Nicaragua. So this is why I think that it will be very useful to apply this project or repeat this project approach in the Northern Triangle. And also INL and United States funds are very committed to increase quality of life level in the Northern Triangle, and they would be very interested in something like this, something like what we're doing in Costa Rica over there.
Okay, thank you. That's super helpful. I do want to open it up to questions for the attendees. If anybody, any of our guests have any questions that they want to ask, please go ahead and type it in the chat and we will get to your questions. I also wanted to ask the panelists, are there any areas of law enforcement accountability that we did not discuss today that you would suggest that we consider? Any areas that you feel are crucially important at the intersection of community and law enforcement, mental health, gender, et cetera, that you might want to flag for us to consider and look into?
And I think one of the biggest things to consider with this, with law enforcement accountability, is this is a very much the role and duty of all officers. We can put the legal frameworks in place, and that's one of the bigger hurdles. But being accountable, being a good officer to the community is an ethos for all officers. We often say the community and problem-oriented policing is the ethos for all officers. It's not just officers who go and talk to neighborhood groups or host coffee with a cop or something like that. It's something that all officers really need to instill into their work and needs to be a part of the culture of every organization of policing. And that really helps build a culture of accountability.
Thank you. Ben.
Yes, I just wanted to add that's important also to talk about mental health law, because that's one thing that still not many countries have. And so this is, at least it helps to define and protects the rights and welfare of persons with mental health problems. And the other component to that is that having the law is not just enough, because we have to move on to ensure that the proper regulations are developed and so that to support the implementation of the law. From our experience in Liberia, in 2017, the mental health law was passed, but we were surprised that in 2020, when we were talking with police officers and the CIT training, they didn't know that we had a mental health law. And we said, but the law has been passed. They say, yeah, but we don't know. We are meant to enforce the law. We are meant to support. How do we know? So then the center now we decided to work to develop regulations to help enforce the law. So that's important. And as we even had a conversation with another country that's talking about passing the mental health law, and we were advising them, well, that is one thing. You need to have a full plan about this, because if they don't know, for instance, the law prohibits admission or treatment by unauthorized facilities. So what is common here in Liberia is for people to catch people with mental health problems, lock them up, confine them, restrain them to logs or chains or so. So you see that in certain places. Now the law is completely against that. And the police, in many cases, they think people are trying to help. So they are not fully aware of these things. So I think it's important to talk about the law, talk about protection around this area.
I think that makes perfect sense. Lami, I'm going to come back to you without video to see if we can hear you better without your video. So you can talk a little bit about what you were saying in relation to migrant rights and law enforcement.
Yeah, so I was saying that we should also take into consideration the issues of migration or migrant rights and law enforcement, because in a lot of situations, these are the people who are seen as the other and they are always abused. They probably will not even know their way around. We have these issues of trafficking now, very serious. In this country, people are trafficked through here to all the places. So maybe we need to start talking about how law enforcement can react to people who are not necessarily from the country in which they find themselves.
Thank you. I know trafficking is a huge issue in many of the countries in which we work, including Metro Atlanta. Thank you for that. So there are a couple questions in the chat. Amy has asked what organizations are working to transform the use of prisons to institutionalize people living with mental illness who often also experience greater abuse and trauma. Do any of the panelists have any responses to this particular question? I mean, I can say, like Tom had noted, I mean, there are organizations right here in Atlanta. There's actually a committee, like a consortium of organizations working to not so much transform the use of prisons, but remove and reduce the use of prisons, so that people who are experiencing just the general everyday difficulties of homelessness, or if they're in mental health crises, that they're getting connected to actual immediate community services and even longer term community services in order to support them, because that's really what they need. so I know that there's a host of them, and one of them that Tom mentioned was PAD Atlanta, the Police and Alternatives and Diversion Initiative, which I put the link to. But are there others that Tom or others might want to raise if they know of? Tom, go ahead.
There's three that come to mind really quick in terms of who are just advocating for prison reform in the U.S. And a big part of that being how mental health crises are dealt, or folks with mental health issues are dealt with in prisons. There's the Vera Institute for Justice. There is, of course, the ACLU, and there's the Georgia Justice Project. And one of the big things to consider in the U.S. and Georgia Metro Atlanta as well is, again, just that decentralized nature of policing, of law enforcement. If someone's arrested in the city of Atlanta by Atlanta police, they're then handed off to the sheriff's department because the sheriffs are the ones responsible for overseeing the jails. And you can have reform within the Atlanta Police Department, but then still be lacking within the sheriff's department, or vice versa. So some of this is really trying to make sure that we're doing this at all levels of law enforcement and not just focusing on one agency.
Thank you. Another question: as a community member, without a lot of interaction with the police, what can I do to contribute to this work? Any thoughts, ideas? I mean, for one is, I think understanding your rights as a citizen when it comes to interaction with the police is important. So learning what those are. But then also, if there are mechanisms like complaints accommodations mechanisms, sharing that so that others are aware too, and utilizing those mechanisms. So you're providing feedback to law enforcement on whether or not they're doing a good or a terrible job. When it comes to PAD and the work that they're doing to divert, a big, huge issue, and I know this is very focused on Metro Atlanta, but something you could do right here in our backyard is not call 911 if you see somebody who might be in mental health crisis or experiencing, just all of the issues that one might experience in experiencing homelessness. So calling 311, which is Metro Atlanta's number, you can be diverted to PAD and be connected to PAD through 311. And now, actually, if you do call 911, there are certain calls that will be diverted to PAD as well. But just knowing and understanding your rights and raising awareness in your own community on how you can, one, hold law enforcement accountable, and two, divert to service, community services for people who really need community services. Do other panelists have anything to add here?
I think you put it very well. Those are the key things. You need to know your rights. You need to inform other people about their rights and responsibilities of the police. Because in my experience, if the police know that people know the responsibilities that they owe to the public, they most times behave properly. That's my experience working with them.
I mean, and get to know some of the, organizations working on these issues in your backyard, the community organizations who are advocating for the policies and advocating for the change to hold law enforcement accountable. Get to know them and, volunteer or show up at the meetings, become an advocate for this type of work and these policies. One last question. How do we get current police to understand the importance of accountability, gender inclusion, and mental health? Is that a law or process that needs to start at the top to be successful?
Well, laws are already in place, at least for Central America, and international treaties are already in place. The thing is that they're not being respected. And why? This is because this is a structural problem. Sexism in at least in Central America, has been so deep, has gone so deep in the structure of its public institutions that it blinds people. So sensitization is not enough. We have definitely to invest in behavioral change and structural change, because laws already exist.
Tom, I don't want to call you out, but I feel like this is like squarely aligned with the work that you're doing.
It is, and I agree a lot with what Sarah just said as it applies to the U.S. here. There are some laws that are in place, but it needs some additional push with that. In the work that I've been doing for the last couple of years, every expert that I've talked to in this really talks about how reform like this is a 20 or 30-year process, and part of that is building up a culture of change within law enforcement. And that's getting your champions on board. Right now, Atlanta just appointed a full-time chief. We had an interim, same person, Chief Shearbaum. Chief Shearbaum is great. He's a great champion of a lot of these different things. He's very well respected by both communities and law enforcement officers inside the APD, but he's only one person. And you need more people in there who are at that sergeant and lieutenant level, that sort of middle management level, who are encouraging the patrol officers to get out there and to do it the right way. And a lot of that means engaging with them now, because eventually they can do that work now, but they'll also level up over that next 20, 30 years and be that future chief, and are pushing that cultural change the entire time. And legal framework wise, there is more that we could do in the US. I think I said this earlier, but Georgia has some of the better police accountability laws in the country, but there's still more that we could do. So it is unfortunately a bit of a mix of both. I wish I had a good, solid magic wand answer, but it's a long process.
I mean, the other thing that I've seen that I think has been incredibly helpful are study tours. I've learned a lot about different divisions or different leadership within police precincts or departments, taking study tours and going to other areas of the country or other countries where they're doing something particularly well, whether it's diversion or whether it's co-responder units for mental health professionals and law enforcement, whether it's de-escalating situations like crisis intervention training, whatever it is, that they're finding the areas in the country or countries where this has been done very well, and they're hosting study abroad or study tours, if you will, to these locations, which is peer-to-peer learning about why this is important and the change that this affects. That is all that we have time for today. I want to greatly thank our panelists again, Lami, Sarah, Ben, and Tom, for speaking with us today. Thanks to all of our attendees and guests, and thanks to Josh and the Education and Development Department for putting this on. Thanks again. I hope everyone has a good rest of your day and week. Take care.
Thank you.